Welcome to Field Notes, Insights from N2PH Health Alumni. N2PH Health is a year-long workforce training program for those who are new into the field of public health. I'm Juliana Mansky.
And I'm Mackenzie Legal. We are program facilitators and hosts of this podcast. With a vibrant community of over 400 current and past residents, N2PH Health is a wealth of knowledge and experience in the public health field.
In each episode, we'll share inspiring stories and valuable insights from those who've journeyed into public health, highlighting their unique path and the impact they're making. Joining us today is Maria de la Luz Lira, public health nurse from Jefferson County in Wisconsin. Maria graduated from the N2PH Health residency program in December 2023. Maria, thank you so much for being with us today. Would you please tell us more about your background as a nurse and how you transitioned into the field of public health?
Yes, and thank you for having me. As a student nurse, I always visualized myself working as a labor and delivery nurse or at an obstetrics or pediatric clinic. In all honesty, I did not know much about public health prior to working here. This area of nursing was only briefly talked about in nursing school. We had one class about public health, and that was pretty much it. Currently, I have been a public health nurse for almost 2.5 years. I was originally hired to be the childhood-led prevention division nurse. My role began to change roughly after the first year. This change was based on the needs of the community. Jefferson County has a growing Spanish-speaking population, and becoming the lead nurse for the Maternal Child Health division helped with the language barrier.
That is one of the things that I love about nursing is that we can be so diverse in where and what we practice and within a specialty like public health. I also really admire that you were able to adapt your passion for maternal child health nursing within public health and recognize the need to better serve Spanish-speaking people in Jefferson County. It sounds like your language skills have helped you advocate for and serve Spanish-speaking people in Jefferson County. Would you tell us more about some of the programs you lead and how you're connecting with Spanish-speaking families?
Yes. In 2023, I became a certified car seat technician and a certified lactation specialist. I am now able to help educate patients about car seat safety and breastfeeding in both English and Spanish. I also teach a Spanish labor delivery / breastfeeding class in partnership with the Watertown Regional Memorial Hospital. The class is offered every 12 weeks, and so far it has been beneficial for first-time mothers and mothers that haven't delivered in the U.S. before. Lastly, I am also the chair of the Jefferson Dodge Breastfeeding Coalition.
That is excellent. What an important ability to be able to offer the bilingual classes and services and being able to chair the Jefferson Dodge Breastfeeding Coalition. That's really a special role that you're able to engage in. I can tell you've really embraced that language justice by ensuring that families can access education and resources in a way that's meaningful to them, especially supporting moms through labor, breastfeeding, and safety education in their preferred language. That's really an important strategy in assuring equitable access to care. Every community has people that speak languages other than English. So based on your work transition and advocacy for offering public health services in the Spanish language, what advice would you share with others regarding public health services in general and access to language justice?
My advice to people is to give public health an opportunity. Call a local health department and ask them if they are willing to let you shadow for a day. Personally, I really enjoy the work that I do, not just as a nurse, but working in public health in general. I also encourage everyone that is taking a second language to continue taking classes or possibly volunteer out in the community to get more experience. In conclusion, the most rewarding thing to me about working in public health is being able to give back to my Spanish-speaking community.
Well said, Maria. Everyone should have the right to learn in a way that's most effective to them. And thank you for being able to provide these bilingual services in Jefferson County. And thank you for the motivation and encouragement to explore or continue learning another language.
Thank you.
Thank you for listening to Field Notes, Insights from N2PH Alumni. For more information, visit N2PHealth.wisc.edu.